Welcome to Palm Bay Live, celebrating 1 year in business.
I just want to take this opportunity Kevin's given me to say thank you. Thank you for instilling a trust in me, to selecting me, choosing me to be the next mayor of this great city we call Palm Bay. I really appreciate the opportunity. I won't let you down. I'll serve you with God, honor, and integrity. May God bless you. May God keep you. May God continue to bless our great city, Palm Bay. Hoorah.
To the end. Okay.
Good morning, and thank you for joining us. I'm Don Walker. I'm Communications Director for Brevard County Government. This is our weekly COVID-19 pandemic update, and we will be providing you briefings from various organizations and health experts, and we will also be attempting to answer many of your questions that you posed to us on Facebook during this event. Our panel of experts today include Public Safety Director Matt Wallace. We have Emergency Management Director John Scott, Brevard County Fire Rescue Chief Mark Schomeyer. From Florida Department of Health Brevard, we have the Administrator Maria Stahl, and we also have the Community Health Director John Davis. From Brevard Public Schools, we have Catherine Allen, who is a senior coordinator there. And we also have today as one of our guests, District 2 Commissioner Brian Lober. And we have Ian Golden, who is our Housing and Human Services Director. And like I said, we have Jesse Ray, who is our social media specialist, who will be monitoring our Facebook Live event for your questions. So we'll start off this morning with a briefing from the Florida Department of Health Brevard, John Davis.
Well, good morning. So want to start off with the numbers that were released this morning. Unfortunately, like I had mentioned last week, I was thinking we would be up around 700 cases per 100,000, and we are a little above that now, 710 cases per 100,000. Again, I want to put that in perspective. At the beginning of the summer, we had gone down as low as about 50 per 100,000. So that just gives you an idea of the saturation of COVID in our community right now. If there's any good things in these numbers, it's that we're certainly not doubling anymore each week as we did throughout the month of July. So I believe from last week to this week, we were up 500 cases more than we saw last week. So again, I don't want to call it a peak. I don't know if we're starting to plateau, a slight increase, but again, that leaves us up here at the plateau, not down at the bottom. So we're still over 4,000 cases in a week. So that's quite substantial. Vaccination wise, our rates did come up a bit. We are seeing more folks come in for their vaccines, which is a great thing. And I encourage folks to continue to come in to get vaccinated. We're at 61% of our population that's vaccine eligible, meaning 12 and over. Our children, the 12 to 14 age range, that came up slightly. 33% are now vaccinated in that age group. And our 15 to 19-year-olds, 41%. The hospitals are still very taxed at this moment. I'm sure John Scott will brief a bit more on that. And certainly with schools opening this week, there's been a lot of activity there, and certainly that's kept everyone busy.
Thank you, John. As John did just mention, our emergency management department is working very closely with the hospitals and FDOH. I will ask for an update now from John Scott. John?
Good morning, everyone. And Don, thank you. Again, my name is John Scott. I'm the Emergency Management Director for Brevard County. A couple things I want to hit on, and I'll start by following what John outlined, which is, we continue to see surging hospital numbers. We continue to know that our hospitals are working very diligently to find extra space, convert existing rooms into negative pressure COVID rooms, and find as many ways as they can to house and accommodate the surge we're seeing. And again, they still have the availability to do that, but it requires a lot of resources. It takes away from other spaces, and it has, again, cascading effects. That's what we talked about last week. What I want to talk about again this week with hospitals. It's not just what we see in hospitals, because we know in addition to COVID, people still fall down, people still break their arms, they still get into car accidents, unfortunately. They still have traumatic health issues like heart attacks. So we've got to find ways to decompress our hospital systems, because the hospital system's at the core of our community healthcare network. So as we see surges in our hospital, we know that translates into longer wait times in emergency rooms, which translates into longer lines at urgent care centers, which translates into more people seeing their primary physician. So it's not just a strain in a single system, it's a strain on the overall system. So we've got to work as a community to begin to relieve some of that strain. And again, I'm going to continue to harp on and focus on core things like, let's wash our hands, let's practice good hand hygiene, let's wear face coverings when we're out in public, let's social distance as much as possible. And really, again, a big one that I think we maybe lose some sight of is, if you're not feeling well, stay home. If you think, hey, it's just allergies and those kinds of things, let's be a little bit more cautious on how we look at that, because allergies are sometimes presenting as early COVID, and then it turns out a day or two later, I thought I had allergies, and actually, no, I'm just mildly symptomatic with COVID. But you're still spreading that virus throughout the week while you're trying to figure out if it's allergies or COVID. So if you're not sure at all, take some initial precautions, because that makes a big difference. Every time we shut down and turn off someone who's either mildly symptomatic, or asymptomatic, but has the potential to spread COVID, every time we cut that off, that's not just stopping it from spreading it to the people that person interacts with, but it's the people that person interacts with and the people that they just interacted with interacting with more people. So it's a ratio. So if we can shut that off at the one person, we don't continue to affect the rest of the community. Those things make big, big differences in this. So again, we're going to continue to call on everyone in Brevard County to be good neighbors, to really be conscientious of how we're impacting each other until we can get our health system far more stable than it is currently. The other thing I want to briefly touch on is testing. I know there's a lot of frustration out there in the community with long lines on testing, and this is what we saw previously. As demand goes up, and you heard John talk about the volume of cases that we've got, and that means testing is also going up, because we have more people who are indeed symptomatic and are trying to figure out allergies or COVID. We had to be more patient. The health department's working on options to do that. We're working with them along with our community partners to find additional ways to bring testing availability. But let's also be realistic in our expectations. We're not going to be able to go and, okay, I don't feel well today, I'm going to go get a test this afternoon. That's just not where we are. It's going to take a couple of days. You're going to have to schedule appointments, and we're going to need everyone to work together on this. But as we're waiting for our test, let's also moderate our behavior. And so instead of, hey, if I'm not feeling well, again, I'm not going to go out and interact with large groups of people. I'm not going to continue to do errands. If I can stay home from my job, stay home from your job. Do all of those kinds of things to help, again, reduce the number of contacts, reduce the number of virus that we're shedding as a community, and really get us back to a place where we can stabilize as a healthcare system and then stabilize as a community. Don?
Thank you, John. The surge in COVID cases has also posed some issues for our fire rescue department, and I will turn it over to Chief Mark Schillmeyer for an update.
Thanks, Don. I always like to start out with giving an overall health assessment of our organization. This week, as of yesterday, we have 4 in quarantine and 18 employees in isolation. That number fluctuates quite a bit each week and kind of ebbs and flows with the cases that we're seeing. We're also seeing an increase in COVID positive and COVID symptomatic patients over the last several weeks. These numbers, again, are equal to, if not greater than we saw back in 2020 during the height of the pandemic. Again, this week, BCFR ambulances are seeing an increase with at-hospital times due to difficulties in turning over the patients to staff, causing those units to hold the wall from anywhere from 30 minutes to an hour and a half. Now, if you recall last week's numbers, that's far better than it was, but it's still an increase in wait times for our crews. We continue to ask people to only dial 911 for emergent and life-threatening issues, and to please save the ambulances and ER trips for those that are urgently in need of those services. Examples of life-threatening emergencies that would require 911 include chest pain, shortness of breath, diabetic emergencies, change in mental status, choking, fainting, loss of consciousness, allergic reactions, severe burns, scalds, uncontrolled bleeding, head or spinal injuries, cardiac arrest, stroke-like symptoms and signs. This is not a all-inclusive. This is certainly not everything that you possibly could call 911 for, but it is just an example of some of those life-threatening emergencies. Some examples of non-emergent issues that don't require an ambulance or a trip to the ER include like a runny nose, minor burns, skin tears, minor lacerations, a car accident with no injuries, and aftercare following a surgical procedure. We see those quite a bit. Again, not an all-inclusive list, but examples to give you an idea. Please help the hospitals and help us take advantage of primary care physicians, telemedicine, or an urgent care. But as John said, the system as a whole is strained. So the urgent cares, telemedicine, and your primary care physician are going to be busy. Our agency continues to work with hospitals on a daily basis to ensure we are doing everything within reason to assist them with any capacity issues. Lastly, when and if you do call 911, we will always respond. There have been no delays in Brevard County Fire Rescue getting our EMTs and paramedics to the scene of an emergency during the pandemic. That's all I have.
All right, thanks, Mark. As many of you know, the new school year is now underway, and for an update from Brevard Public Schools, I'll turn it over to Catherine Allen. Catherine.
Thanks, Don. Again, I'm Catherine Allen, Senior Coordinator for Brevard Public Schools, and obviously, school year started this year. We've kicked it off on Tuesday, and then today our kindergarten students are joining us. So while there's a time of obvious uncertainty in our community, there's also a time of excitement for our students. And so we're really encouraging, people in our community and our parents, our children are fearful when they see fear and uncertainty. And when we react to one another, without kindness being at the forefront, they're seeing that and unfortunately could be emulating that as well. So masks, again, are optional for this school year, but we highly encourage our students to wear face coverings. We're encouraging everyone that's of age to get the vaccine. If you're able to, please do so. Again, we're going to echo a lot of what others on our panel are saying, good hand hygiene. And please, please keep your child home if they are sick, if they don't feel well, even if you're not sure if it's allergies. As you also heard on this panel, many times the symptoms of COVID can resemble other things that may not seem very serious, but could in fact result in more spread. So it is something that we would expect that our dashboard numbers are going to be obviously higher than they have been previously. We're in a different place in this pandemic than we were last year. We are doing our dashboard every Tuesday and every Friday. They'll be posted by the end of the business day. So that information is always going to be available to you at brevardschools.org/COVID-19. You'll also find all of our mitigation strategies for the school year, as well as quarantine procedures for students who feel sick or for students or employees who've been a close contact to an individual who's been positive for COVID-19. So a lot of questions on quarantine processes and things of that nature. Those flowcharts will do a really good job of explaining different scenarios to you. However, we're always available to help you cipher that data. And again, we're just going to ask that you continue to do the part that you can in your own home, making sure if you're sick, you stay home, good hand hygiene. And we are asking you, please, please, grace and flexibility are going to go a long way. We're all working through this together, and I think it's critically important that we remember that our littlest learners in our community are watching all of us. And I think it's really essential that we work together, and even when we have differing points of view, that we still treat one another with respect and kindness. It goes a long way, not just in the education world. That's all, Don.
All right. Thank you, Catherine. As Emergency Management Director John Scott mentioned, there are cascading effects of this surge in COVID-19 cases. And we know it's taking an economic toll on many of our residents as well. And there is assistance available. And I have Ian Golden, our Housing and Human Services Director, here today to provide you some information on those types of assistance. Ian?
Thanks, Don. First off, just some data regarding the programs that we're running, our emergency rental assistance. It actually covers both rental, what you could be arrearage, what could be owed, as well as prospective payments. It can also be used for utility assistance for arrearage also. We've received about 1,347 initial applications. On top of that, we've gotten about 250 secondary applications. The requirement is if we're helping you moving forward, you still have to recertify and reapply every 3 months to tell us that you need assistance. We've obligated about 5.7 million of the 18 million that we had allocated to us. So our rate of expenditure is a little bit over what we were projecting on a month-by-month basis to extend for the entire 18-month period of the funding. We're about at 155% expenditure rate, so a little bit over, like I said. And then real quick, if it's up, I'd like to take you through the actual application process real quickly, just to hopefully answer some questions and to also allow people another opportunity to find out where it is. So the actual physical application is available at all county libraries. You can go, there are copies available. You can pick up a copy, take it home, fill it out, drop it back at the library. We have staff that go to the libraries every day to retrieve applications. In addition, if you go to brevardfl.gov/human services, that's the department's website. And at the very top of the website, you'll see our emergency rental assistance application. So you can also download it from this application. We have it as a fillable PDF document where, again, you can download it, print it out, fill it out, drop it at a library. We'll pick it up. Or you can drop it here in Viera at our offices in Building B. In addition, we have an online application portal where you can complete the entire application online, including submission. So the first page, give it a second. First page gives you some basic information about eligibility. Income eligibility, you have to be at 80% or under area median income. So you can see for a family of 4, that's actually, this needs to be updated. It's gone up. It's 58,100, I believe, as of right now. It adjusts every year. So I think this was the 2020. We need to put the 2021 up here. Before you can get into the application, you have to check that you've read this, and then you can actually go into the application itself. So right off the bat, should be, again, easy, fillable. We want to know things like, have you applied for assistance anywhere else? We want to know who's completing the application. A landlord can complete an application on a renter's behalf. The renter just has to sign the application. So a landlord, if they have multiple people who have assistance, they can fill out multiple applications and try and push through the system and get themselves reimbursed and help those people who need assistance. We want to get an idea of how much is owed, how much your rent is on a monthly basis, a little bit about the household itself, the renters, everybody in the household, because if you remember from that income eligibility chart, the number of people in the household determines how much the number in the household adjusts the amount that you can't be over to be income eligible. Some demographic information. One of the priority areas that we look at is whether or not somebody is getting unemployment, and if they've been getting unemployment for the 90 days prior to application. So we ask you to provide us that information. If you are employed, we want to know. It doesn't mean you're not eligible. You could have had a reduction in income, because eligibility is based on income, but there's also got to be a COVID impact. And typically we look for a financial impact, but it could be a direct impact, such as you lost your job or your hours got cut. It could also be an indirect impact. And we define that, for example, we have a lot of seniors who, because of COVID, are homebound, and now they're paying more for grocery delivery, or they may be having more medical bills. That could be an indirect impact. And so that could also potentially be eligible. So we want to have you give us a brief description. We want to get an idea of household income. Again, assistance from other agencies, what type you've requested, and then we get into the documents that we require as backup. So when we first started the program, we required much more to determine income eligibility. We required bank statements, we required pay stubs, we required your unemployment data. Now that we're past the point of your income taxes, if you've done your income taxes, your 2020 income tax, your 1040, is enough for us to determine income eligibility. So the other things that are in here about like profit loss statements, these documents, the one for self-declaration, Social Security, all of that is now covered by a 1040. So the other things that we have to have, though, that I can't get around is I have to have a valid lease. So that's a lease that covers the time period that you're requesting assistance for. It has to be signed by the landlord. It has to be signed by you. It can't be a handwritten one-page document, which we have received and we've had to reject. We have to have a statement from the landlord that shows us exactly if there is arrearage, what that arrearage is, what the charges are. If there are any fees, we can pay those. We also then have to have what's called a W-9. It's an IRS form. It's something the landlord fills out. And it allows the county to actually cut a check to the landlord. So our financial system, our clerk will not cut a check without a W-9 form. So that's a requirement. We have had some landlords, and it's kind of delayed our process because the document allows for their TIN or their Social Security number. One identifying number is required on the document. We've had some landlords who are hesitant because they didn't want to give that document with a Social Security number to their renter. And that's fine. Let us know. We will reach out to the landlord. We will contact them. We will work through that where they can deliver it to us and get it to us directly to try and address that. So again, you go through all of this. There's an electronic signature. You have to check that you've read it. And then there will be an electronic signature. There'll be several documents. This form is if you have no income. You can check this and give us an explanation of how you, with no income, pay for your expenses. Again, signature. And then this is a waiver. If you give us a Social Security number on any of the documents, this gives us a waiver. It's not that we're giving out your Social Security number. It's just that it allows us to accept your Social Security number. If I had finished this document and signed everything, it would allow me to submit and move on to the next step. The next step is actually uploading those documents like your lease, the W-9 if your landlord's willing to give it to you, your 1040, those type of documents. When you do give us your lease, we need more than just the first page because we've got that before. We need the entire lease, including the signature pages. I think that's it.
All right, thank you, Ian. I believe Ian has it covered. So, all right. So as I mentioned at the front of this event, we have been monitoring Facebook for any questions that you may have that we will do our best to answer. But just before I go to the questions, we have been monitoring Tropical Depression Fred. And since I've got Emergency Management Director John Scott with us today, I'm going to turn it over to John for just a brief update on Fred before we go to questions.
Thanks, Don. Yeah, and it is an important piece. We talk about, August, September, and October are our peak season for us. It really is the heart of hurricane season. We're walking right into that now. So I want to talk about Tropical Depression, Tropical Storm Fred as it continues to go. Continue to be good news for us in Brevard County as it's holding its track of going sort of into the Florida Keys and out into the Gulf and paralleling the west coast of Florida as it moves north and eventually making landfall in the Panhandle. Should be as probably what will be a tropical storm in some level of intensity. We'll see what happens once it gets out of the Gulf. I want to highlight that just because the storm's to our west doesn't mean we won't see any impacts from it. Fortunately, we're not going to see the heavier impacts, but we know that any sort of system always brings additional moisture, so we're likely to see higher rain coverage, and in some cases we may see some persistent banding, so where we see bands just sort of come through the same area over a period of time. Those areas that experience that may see some localized flooding, but it should be mostly contained to street flooding, maybe even a little bit of yard flooding, but that stuff should dissipate. I also would be remiss if I didn't mention at 11 o'clock, the Hurricane Center gave us a potential Tropical Cyclone 7. If you don't know what PTC means, it basically means it's the step before it becomes a tropical depression or a tropical storm. PTC7 is forecast to become a tropical depression and storm in the coming days. The next name will be Grace, and it's certainly going to be something we need to watch as we continue in the next couple of days. It's about a week behind where we are now, so this time next week we'll more than likely be talking about Grace in some way, shape, or form. And I really want to remind everyone, again, we're in peak season. It's absolutely the time you need to have your hurricane plans in place. You've got your disaster supply kit. You know what you're going to do. You know where you're going to go, and you know what's going to force you to do those things. That is critical. And I just want to really say it's good to have an idea of what you want to do, but an idea is a thought. If you actually take the time to write down what it is you're going to do, that becomes a plan. And we know that people are more likely to execute a plan once they've written it down. So please just take a couple of minutes to write down who, what, when, where, why, and how you're going to approach any sort of tropical event. And again, continue to be vigilant. Follow us here at Brevard County for updates. Follow the National Weather Service Melbourne. We'll continue to keep you informed the best we can. Thanks, Don.
Thank you, John. So now we will field questions. Jesse, please fire away.
Awesome. Thank you, Don. So I'll get some of our media questions out of the way first. For Commissioner Lober, what would you like to see the county government administration or the county commission do that isn't being done now to help reduce the spread of COVID-19?
That's a really good question. Am I allowed to ask who asked it?
That would be Dave Berman.
All right, Mr. Berman. It's a complex question. I think part of the reason for that complexity is that you have a group of people, a large group of people that are rightly, wrongly, somewhere in between perhaps the two, distrustful of the government. So I think there is automatically some level of recoiling or resistance if the government is pushing beyond a certain degree to get vaccinated. Obviously, if someone asks me, I'm going to tell them I've been vaccinated. Everyone in my family has been vaccinated. As soon as I had the opportunity to get vaccinated, I got vaccinated, as did everyone else in my immediate and even extended family that I'm aware of. In terms of what we can do beyond what we're already doing and beyond what's already been discussed, the only thing that comes to mind, because there really aren't that many opportunities that have gone without having been explored, but the only thing that comes to mind is our negotiations with the fire union, the IAFF. When those are concluded, presuming they go the way that they're looking to go, we'll be able to advertise significantly higher starting salaries for paramedics and EMTs and also firefighters that have one or the other credential, in addition to being licensed by the state to be firefighters if they're entitled to be EMTs or paramedics. We're looking to fill a number of positions within BCFR, as I believe Chief Schulmeyer mentioned earlier during this briefing. We have, I think as he put it, a lot of our paramedics and EMTs hugging the wall at hospitals, which means we have far fewer out there able to serve the community. I can tell you earlier this week, the number that I had heard speaking with one of the district chiefs with BCFR was that we had 7 ambulances at one point, the day that I'd spoken with him, lined up at one hospital, waiting for the hospital to receive the patients from the EMTs and paramedics. That's something that ties up our resources. I don't begrudge the hospitals because I believe they're doing everything that they reasonably can. I understand that they've taken administrative staff that's licensed to either practice medicine as an MD or DO, or even bringing nursing staff that does a lot of the admin work into the clinical setting of treating patients. I think the faster we get that IAFF union negotiation wrapped up, the sooner we'll be able to turn around and start to advertise those higher salaries that will enable us to increase the ranks of EMTs and paramedics locally. But beyond that, I don't know that there's anything that we can do within reason that we're not already doing.
Okay, excellent. Thank you. I appreciate that. For the health department or emergency management, what are the biggest issues in Brevard County hospital systems right now related to staffing, capacity, and supplies?
Sure, I'll start with that. I think the answer to all of that is the strain it's putting on. Again, they're spending more resources, whether that's staffing, whether that's supplies, whether that's space, because we have more people who are sick and in hospitals. So anytime demand for anything that goes up, you're going to put a strain on things. It's not one specific thing. It's sort of cumulative, especially for staff and those kinds of things, as we continue to ask them to work longer, work harder, cover more sections, do more with the resources they've got. Again, I want to highlight and compliment the good work that our hospital systems are doing along with their teams to respond to a very challenging situation. It is a simple demand is up. It puts a strain on things.
Okay, thank you. So Catherine, can you address the COVID cases confirmed by the district at Sable Elementary School in Melbourne? How many are students versus teachers?
We don't actually discuss schools on an individual level in terms of cases. We do a cumulative case number on our dashboard, and then we do breakout quarantines by school. That's actually maybe a good question for the Florida Department of Education, or I'm sorry, Florida Department of Health. Last year, you guys had reporting by school number. Do you guys know if that's coming back? Because we've actually heard that that's not available, but that's never been a way that we have reported data, nor will it be in our future.
Yeah. The only way the Department of Health is reporting data at this time is the weekly reports. The weekly reports give the information by county, broken down by total number of cases, total vaccinations given, cumulative, and that week in the county. A little more detailed information is given on the CDC website. However, there will not be anything provided at the state level per school.
Okay, thank you.
Jesse, can I just add something
Yes,
really
go
quick
right
to
ahead.
that? Just so parents that may be watching, you will be notified by the school if there are COVID positive cases in your school. You will receive a general information from the principal. That's something that will come to your email. So if you're not seeing that, or you're hearing that there's cases in your school, but you're not sure, make sure that your school has your contact information. If your child has been determined by the Department of Health and through our teams on site at our schools that they need to quarantine due to being a close contact, you're going to get a phone call, and you're also going to receive a letter from the Department of Health that tells you what to do and what those quarantine periods look like. So you will be notified. We just don't have a dashboard that we report case numbers broken out by school that way.
Okay, thank you so much. Ian, I actually have a question for you. So do we have rental assistance in the sense for like moving into a new place, i.e. deposits, first month's rent, those kind of things?
We're currently still working with Treasury regarding that. We've been told that we can use the funds for security deposits. The question that we have for Treasury is most landlords require a security, a first and a last. The way the rules for eligibility under the law that was passed in December read, you have to have a obligation to pay rent on a residential property. So you have to have a signed lease to be eligible as an eligible household. So if I can't get a signed lease because you don't have first, last, and security, I can't assist you. So that's the question that I've posed to Treasury is how do we get around that? And we're actually working with the county attorney's office on some ideas that we've had, but we need to get that kind of in place before we are able to move forward.
Okay, excellent. Thank you, Ian. Department of Health. I only have time for a few more. So Department of Health, if you are sick, not with COVID, can you get a vaccine?
Yes, absolutely. Although if somebody's having COVID-like symptoms, they should wait until those symptoms have dissipated before they become vaccinated.
Okay, thank you. John, so you mentioned the hurricane or a possible tropical cyclone coming this direction. If we are hit with a hurricane or tropical storm, are we working on plans, or are there plans in place for hospitals to evacuate patients if that's necessary? Is there places for them to go? Are there plans in place?
So the short answer to that question is yes.
Okay.
And that's something we consistently work on. We work on all year on those kinds of things. We had plans in place last year. We have plans in place this year, and we continue to adjust. We get the good fortune of working in a very dynamic environment. So that means we have to constantly readjust and alter those plans with the reality that we're seeing, and we're doing that right now.
Excellent. Thank you. Okay, I've got three more. Are we expecting FDA approval beyond emergency use, and when?
I believe that it's looking like towards the end of this month or the beginning of September, the FDA is likely to provide full approval of the Pfizer and Moderna.
Pfizer and Moderna. Okay, thank you. Bed availability in our hospitals. What is that looking like? And do we know how many of the beds are taken up because of COVID patients versus like trauma alerts and those kind of things?
Sure. So I referenced a dynamic environment, and that nothing more applicable. I mean, it's super dynamic in a hospital system right now. So yes, there are beds available. Hard to quantify what that number is because it changes on an hourly basis. I would say for most hospital systems, in general, they're seeing a majority, whether that's 51%, that are COVID related. They continue to create more space in there. They continue to work to find creative solutions. Hard to pin that number down because it changes, but there's absolutely a surge there, which we've talked at great length about.
Right, which is why.
Jesse, just to tack on to that as well, and I don't mean to paint a slightly gloomier picture than what John mentioned, but I do want to focus on one of the more operative words that he mentioned, at present or currently. As recently as earlier this week, I understand that at least one of the three major hospital systems within Brevard County had reached out to BCFR to ask us to divert ambulances to other facilities because they had no capacity. So that's something that really does change on a very frequent basis. And capacity and bed availability may not mean what most folks take it to mean. It may mean that they can find a spot in a hall to stick you in where you're technically in their system, but it doesn't mean that you're in a room. Forget an individual room or a double occupancy room.
Right.
You may be in a hall, assuming they have the capacity to take you in a hall. So it's something that I would just urge folks to take with a grain of salt, any current availability, because that really does change on a very frequent basis.
Okay. Yeah. Thank you. Chief, did you have anything that you wanted to add about, diverting to other hospitals or anything?
No, we have had two occasions where we've had a hospital divert, which puts an additional strain on the system, but we have a very dynamic response model, and we have a regional EMS system, so we're able to bounce back pretty quickly.
Okay. Gotcha. And last question is actually for you, Commissioner. Are there any, and this is a winner, any plans or thoughts on mask mandates here in Brevard County?
There is a huge difference between a mandate and a recommendation. I'll just tell you, and this will take a second, and I apologize for giving you kind of a long-winded answer, but I'm hoping I will answer your question in the process. There are a lot of folks that are of the impression that masks are ineffective. There are a lot of folks that are upset with recommendations that are coming out of DC and in some cases Tallahassee. What I will tell you is what I've heard from board certified, American trained MDs and DOs, physicians who are licensed to practice medicine, as well as a couple of professional engineers who do product development and cloth product development in particular, things like masks. no one has claimed that an individual virus, what's the term, Maria? Is it virion? Whatever the technical term is for it, for an individual lone virus. No, I don't think anyone has claimed, any expert or any non-expert has claimed that the size of an individual virus is such that it'll be blocked by the pores in a cloth mask. I don't think anyone's claiming that. I don't think anyone's claiming that N95 masks aren't better than cloth masks. I don't think anyone's claiming that P100 or N100 masks aren't even better than that. What I have come to understand by people who are smarter than I am, who are better educated and better trained than I am, and these aren't people who I've sought out because I have some preconceived notion and I'm gravitating toward folks that share my preconceived notion. What I've come to understand is that it reduces the percentage of spread. It doesn't stop spread altogether. It doesn't mean that every individual virus is going to be kept within the mask. As I've come to understand as well, from having spoken with a number of experts, folks that have terminal level degrees in their respective professions, whether it be in medicine or in engineering, the way that a lot of these coronaviruses, not just COVID-19, are spread involve respiratory droplets, not people, sneezing necessarily, but even just speaking, yelling, singing, breathing. If you take your glasses off here, we'll see if the camera is good enough. I mean, you can see I can fog this up here. The bottom line is you have respiratory droplets with folks that are either sometimes asymptomatic or even folks that are symptomatic that are just laden and teeming with viruses. Those are what the masks are more effective at stopping than an individual lone virus. And the current understanding, as has been relayed to me, is that that's generally how people end up getting COVID, from these respiratory droplets that are stopped to a double-digit percentage degree by the masks. I will tell you, I agree that it's frustrating that we've had varying recommendations from the CDC. I will tell you it's kind of aggravating that they say at first mask, then no mask. If you've been vaccinated, then mask anyway. What I will tell you, though, as well, although everyone has a right to question the recommendations, the statistics upon which those recommendations are based seem very solid. If the CDC said that a certain percentage of individuals were tested out of a pool of a certain size, I don't know that we have a reason to question that. I think we may have a reason to question whether the recommendations make sense. But in terms of whether or not masks are effective, I don't think there's a question that they prevent a certain percentage of spread. Now, that said, I think it's a great idea to wear masks, most especially if you're not vaccinated. Most especially if you can't social distance. I'll use myself as an example sitting here. If you want to zoom out, Logan, you can see I can put my arms out and I'm about 6 feet tall. If someone else put their arms out, they're at least 6 feet away from me. I wouldn't be able to touch fingers with anyone on either side. If I were sitting next to someone for a prolonged period of time, especially if I knew they weren't vaccinated, I sure as heck would be wearing a mask, and I would hope that they would do likewise. I don't think there is a will at this point. I personally had pushed to have a masking requirement early in the pandemic, prior to the time that vaccines were available. I thought it was a great idea then. I didn't think that it was something that the detriments outweighed the benefits. And it also, at the time when I pushed for it, it was seen as a measure, and it was anticipated as a measure that would prevent us from doing more egregious, more impactful steps, taking more impactful steps that would harm businesses and harm the locality, harm the community. We didn't want to get, and I didn't want to get to a position where we had to do what Governor DeSantis felt that was appropriate or necessary in shutting down certain businesses. If a choice is available between wearing wearing a piece of cloth over your face that is uncomfortable, that's aggravating, I get that. When you go to certain businesses, or simply not being able to go to the businesses because we're shutting them down, I can tell you the business owners are probably going to be in one camp with respect to that, because some business is certainly better than no business, and shutting doors is the last thing we want to do. I had folks at the time, business owners, telling me that they were afraid to require masks on their own because it had become so politicized that they were concerned they'd lose a portion of their base, and they wanted the government to do what they were scared to do. At this point, though, with vaccines readily available, The situation has changed substantially from what it was when I had recommended and pushed for a masking requirement in certain indoor businesses. I'm not at a point where I'm pushing for it at this point. I don't think any of my colleagues, any of my fellow commissioners are pushing for it. I just think the availability of vaccines, where now there is a legitimate chance that they may expire before they're even administered, the whole environment has changed such that the concerns that existed before, where people had essentially no ability to protect themselves other than being hermits, that doesn't exist any longer. So the long-winded version of it is no. I don't think there's a realistic chance at this juncture of there being a mask mandate. I'll certainly continue to do everything I can to encourage folks to get vaccinated. If folks are within that social distance 6-foot magic number, certainly I'd be inclined to wear a mask, most especially if they're not vaccinated, or I have a question as to whether or not they've been vaccinated. But no, I don't think we're going to have a mask mandate at this current juncture. If things fall off the cliff, obviously we'll take it where it goes, but I don't see it as a realistic possibility at this point.
All right. Thank you, Commissioner. So that's it for questions today. And I do want to end our program to let you know that on Tuesday, this coming Tuesday, August 17th, Brevard County government will be holding a job fair here at the Government Center in Viera, 2725 Judge Fran Jamieson Way, from 10 a.m. to 6 p.m. And there are a variety of positions available, which you'll find on our website, brevardfl.gov. But we're looking for hires for public works, solid waste. Brevard County Fire Rescue will have representatives there. We're looking for school crossing guards, and even the sheriff's office will be on hand. So if you're looking for employment, Tuesday's a good day to come out and get to know us, and hopefully, better your future. So thank you for joining us today, and we will talk to you next Friday. Thank you.